10 silent diseases you only discover through exams. It's possible for someone to live seemingly healthily for years, and at a certain point be diagnosed with an advanced stage pathology. This happens because there are silent diseases, medical conditions that only show signs when they are in an advanced and severe stage. Did you know that many of these conditions can be detected very early with simple exams, completely changing the prognosis? Let's explore together 10 silent diseases that could be lurking without you noticing, and how science provides us tools to fight them before they become greater threats. Do you know which silent disease is the main cause of blindness in the world, and how we can detect it early? Throughout the video, I will answer these questions and discuss how small preventive actions can save lives and significantly improve quality of life. And in the end, we'll reveal an effective way to prevent the progression of a disease that affects millions of people worldwide and few doctors can diagnose. Moreover, get ready for a surprise. I will show you how a simple visit to the ophthalmologist can reveal more about your overall health than you might think. Prepare to learn about the 10 silent diseases you only discover through exams. The sixth and last disease are the most dangerous. But before, I need to alert you about something extremely important. What I'm about to tell you now could be the difference between life and death. The cost of silence. The vital importance of early diagnosis and treatment. Delay in diagnosis and treatment of diseases can lead to serious complications, making treatments more complex, lengthy, and with fewer chances of success. The worsening of the clinical picture is a direct consequence of this delay, especially in diseases like cancer, where the risk of metastases significantly increases. Moreover, diseases not diagnosed and treated in time can affect various organs, causing irreversible damage, as in the cases of high blood pressure and diabetes, which can lead to serious problems like brain damage and risk of amputation. Treatments for advanced conditions tend to be more invasive, risky, and expensive. Additionally, silent diseases, especially infectious ones, pose a significant risk of contamination to others, highlighting the importance of early diagnosis and appropriate treatment for all ages and genders, aiming to prevent the progression and complications of diseases. Now, let's go. 10 silent diseases you only discover through exams. 1. Kidney diseases. Chronic kidney disease, CKD, represents a significant health challenge, characterizing as a silent and severe condition affecting the kidneys, essential in eliminating toxins and regulating the body's acid-base balance. The development of this disease occurs suddenly and often without noticeable symptoms, advancing until reaching a critical stage that can completely compromise kidney function, leading to extreme consequences such as coma. However, when identified early, CKD has a favorable prognosis with a high success rate in treatment. Early detection is possible through specific exams, such as urine analysis and measurements of creatinine levels in the blood, which are key indicators of kidney function. These tests should be interpreted by a nephrologist who can then guide the course of treatment. Despite the absence of a definitive cure, early diagnosis is crucial, emphasizing the importance of regular health exams for the prevention of severe complications associated with chronic kidney disease. 2. Cardiovascular diseases, hypertension, and cholesterol. Complications arising from diseases such as high blood pressure and high cholesterol are crucial for the health of the heart and blood vessels, ranking among the main causes of stroke, CVA, an event that can result in fatalities. High cholesterol, one of the most dangerous silent conditions, can be identified through routine blood tests, allowing for a specific treatment to be prescribed once diagnosed. Similarly, hypertension, another significant risk factor, is detected by measuring blood pressure, a procedure performed by health professionals with appropriate equipment. These diagnostic methods are essential for preventing more serious problems, enabling medical intervention in early stages, which is crucial to avoid more severe consequences like stroke, underlining the importance of regular medical follow-up and attention to health conditions that often remain hidden until they cause significant complications. 3. Colon cancer. Colon cancer is an insidious condition that often develops silently, without showing obvious or distinctive symptoms in its early stages. This characteristic allows the disease to progress unnoticed, as signs, when present, tend to be subtle or easily confused with other medical conditions, complicating the challenge of early recognition. The National Cancer Institute, INCA, highlights the importance of early detection of this type of cancer, which can significantly increase the chances of successful treatment. For this, a series of examinations is recommended, including clinical assessments, laboratory tests, endoscopic procedures, and radiological studies. A biopsy, a procedure in which a tissue sample is collected from the suspected area for pathological analysis, is often used to confirm the presence of the disease. This diagnostic method is crucial for establishing the presence of colon cancer and initiating appropriate treatment, emphasizing the need for medical vigilance to identify and intervene in the disease as early as possible. 4. Osteoporosis. Osteoporosis is another disease that manifests itself silently, often only revealing itself after a minor traumatic event, such as a fracture resulting from a non-severe fall. This condition is primarily attributed to a decrease in estrogen levels, an essential hormone in maintaining bone density. Osteoporosis is characterized by the significant fragility of the bones, which become thinner and more prone to breaks. For its diagnosis, a specific examination called bone densitometry is used, which assesses the presence of calcium, in addition to measuring bone density and mineralization. This examination is fundamental for identifying osteoporosis, allowing the implementation of therapeutic strategies aimed at strengthening bones and preventing fractures, highlighting the importance of preventive exams for the early detection of this condition that significantly compromises the quality of life of affected individuals. 5. Liver diseases. Hepatic steatosis, also known as fat accumulation in the liver, falls into the category of silent liver diseases, challenging early diagnosis due to the absence of specific symptoms in its early stages. This disorder, characterized by excess fat in liver cells, can progress without evident signs, making it difficult to identify until symptoms manifest, which, when they occur, often mimic other medical conditions. This symptomatic similarity can delay appropriate recognition and treatment, compromising the possibilities of early cure. Early detection of hepatic steatosis is not only crucial for effective therapeutic intervention, but also because the condition significantly increases the risk of cardiovascular complications. For the diagnosis of hepatic steatosis, specific blood tests that assess liver function are used, in addition to imaging methods such as ultrasonography, computed tomography, and magnetic resonance imaging, which can identify fat accumulation in the liver. The importance of regular exams and medical follow-up is reinforced by the need to identify and manage hepatic steatosis before it progresses to more severe conditions, underlining the relevance of vigilance in liver health. 6. Glaucoma. Glaucoma, a serious eye disease that affects the optic nerve, is one of the leading causes of blindness worldwide. Notoriously silent in its early stages, glaucoma progresses without clear signs, allowing vision loss to occur gradually and irreversibly before being detected. The absence of noticeable symptoms in the preliminary phases complicates the early recognition of the disease, which emphasizes the importance of regular ophthalmological exams. During such exams, the ophthalmologist evaluates intraocular pressure, a key indicator for the diagnosis of glaucoma. Although the condition cannot be reversed, timely identification and treatment can control the progression of the disease and minimize the risk of significant visual loss. Therefore, monitoring eye health and periodically undergoing specialized examinations are essential to prevent the more severe consequences of glaucoma. 7. Prostate cancer. Prostate cancer, predominantly found in men and located in the prostate, a gland juxtaposed to the bladder, stands out as one of the most common cancers in this group. Its insidious nature lies in the fact that it is, for the most part, a silent disease during its initial stages, making early diagnostic challenge without specific examinations. For early detection, the PSA, prostate-specific antigen blood test, and digital rectal exam are strongly recommended, particularly from the age of 50. These preventive measures are crucial for identifying the disease at a stage where treatment can be more effective and less invasive. The discussion about prostate cancer, as well as other silent diseases mentioned, underscores the vital importance of regular health screenings. These checkups become even more relevant as people age, aiming for the early diagnosis of medical conditions that, if not detected and treated in time, can progress to more severe stages. The implementation of a routine medical assessment is therefore a fundamental pillar in the prevention and effective management of diseases, ensuring a higher quality of life and well-being, especially in old age. 8. AIDS. AIDS, an acronym for Acquired Immunodeficiency Syndrome, is a serious condition caused by the human immunodeficiency virus, HIV, classified among sexually transmitted infections, STIs. Its transmission can occur through transfusions of contaminated blood, unprotected sexual relations, and other means involving the exchange of infected body fluids. HIV has the capacity to attack the immune system, destroying T lymphocytes and other cells essential for the body's defense, which significantly increases the risk of secondary infections, such as hepatitis and pneumonia, among others. One of the most alarming aspects of AIDS is the possibility of virus carriers transmitting it without being aware of their condition, due to the often asymptomatic nature of the disease in its early stages. This underscores the importance of consistent condom use in all sexual relations as a primary preventive measure. Additionally, it is recommended to take the anti-HIV test approximately 30 days after any potential exposure to the virus as a means of early detection. Although still incurable, advances in treatments available for HIV/AIDS have allowed seropositive individuals to enjoy a significantly better and longer quality of life. These treatments, increasingly effective, are crucial for controlling the virus's progression in the body, highlighting a scenario of hope and continuous improvement in the management of this challenging disease. 9. Diabetes. Diabetes is a prevalent health condition affecting approximately 6.9% of the global population, totaling about 537 million individuals. This metabolic disorder manifests in two main variants: type 1, usually identified in childhood, and type 2, which tends to develop and be diagnosed later in life. Type 2 diabetes is particularly insidious, as its symptoms can be subtle and gradually progressive, including increased thirst, frequent urination, and weight changes. This unalarming nature of the signs leads many people to live with the disease for years without a formal diagnosis, increasing the risk of serious complications. The repercussions of late diagnosis and treatment of diabetes are diverse and significant. Among them, the loss of vision, tissue necrosis, and damage to vital organs, with an emphasis on the kidneys, which can suffer severe functional deterioration. Therefore, upon recognizing the condition, it is essential to adopt effective management involving regular monitoring of blood glucose levels, a balanced diet, and consistent physical activity. These measures not only help control the progression of diabetes, but also contribute to the prevention of its more severe complications, emphasizing the importance of a proactive approach to health and well-being. 10. HPV. The human papillomavirus, HPV, is one of the most common sexually transmitted infections, STIs, spreading not only through sexual relations but also through contact with contaminated surfaces. Its predominantly silent nature means that infected individuals can, inadvertently, transmit the virus without being aware of their own infection, making prevention and early diagnosis significant challenges in the fight against HPV. In women, HPV may not show visible symptoms, but in some cases leads to the development of warts or polyps in areas such as the urethra, the anus, the uterus, and the vagina. The importance of early treatment lies in HPV's capacity to evolve into more severe conditions, including cancer, particularly cervical cancer. For prevention, regular examinations are recommended, such as the Pap smear and colonoscopy, which are fundamental for the early detection of cellular changes indicative of HPV infection. Similarly, men infected with HPV may develop warts on the penis, scrotum, or anus, though many may remain asymptomatic. Prevention through consistent condom use in all sexual relations is crucial to reduce the risk of transmission. Additionally, specific examinations, such as peniscopy, are available for men who suspect they have been exposed to the virus. Therefore, awareness of HPV, its prevention through safe sexual practices, and the importance of regular exams are key elements in reducing the prevalence of this STI and its potentially severe health consequences. Thank you for watching. Don't forget to subscribe to the channel. See you in the next